Steve's eye, small eye, my eye.
Yes.
Okay. First, let's look at the layers. I'm going to point both the models because we don't know which one we may use. Colors are different, so don't worry about the colors. You have to understand where the parts are. Outermost layer, sclera. In this, you can see the second layer, colored layer, choroid. In this one, this is your choroid. See the colored layer with all the nerve endings and blood vessels. Okay. Yeah, it's kind of purplish. Third layer inside, innermost layer, retina. You can see from inside also. Okay. In this one, if I take this out, you can see the retina, right? Okay, those are the layers. Then let's look at the other structure starting from the front to the back, anterior to the posterior side of the eye. So right here, I'm touching the cornea. Okay, lens is behind the iris. So let me remove this. Now you can see the colored structure here. That's your iris. With the iris muscles, the lines, and the hole is your pupil. In this model, okay, so this is your iris with the iris muscles that help to open and close the pupil. This is your pupil in this model. Okay. So behind that, you have the lens. You can tell the lens because it is smaller than the cornea, and also you can see both sides are curved compared to the cornea, which is a biconvex. Yeah. So if you see in this model, where did my lens go? Okay, you will find the lens that's very small and it's attached from the inside. Okay. So we did the lens. How does this lens hang from the roof of the eye? Okay. So in this model, you can see the suspensory ligaments, and they attach to the ciliary muscle. Okay. You can see from this cross section of the cut open view, you can see the ciliary muscle. In this model, this is your ciliary muscle or the ciliary body, and those lines represent your suspensory ligaments. Okay. So this is your anterior chamber in the front of the eye between the cornea and the lens, and then behind that is your posterior chamber. So the anterior chamber, you have aqueous humor. It's a watery fluid that constantly keeps running from top to bottom. But on the posterior chamber, what you have is your vitreous humor. Okay, that fills your posterior chamber. There is my vitreous chamber and this missing. It's okay. Alright, so moving on. You see here at the posterior end of the eye, you see the optic nerve coming in, surrounded by the optic disc. And right next to the point where the optic nerve enters, you'll see the macula lutea and the fovea centralis, the colored area with the little tiny dot. It's more obvious in this model. You see, look carefully, there is a big circle and a small circle.
Macula lutea.
Yeah, the large circular area is your macula lutea, and the tiny dot, that's your fovea centralis. And this is your optic disc where the optic nerve enters. This is your optic nerve, and it's enclosed by the tube, which is the optic disc, tube-like structure, optic disc. Okay. Then let's do the muscles. The rectus muscles, you have one, two, one at the top or the bottom, one at the bottom, two on either side. So these two, superior, inferior rectus, medial, lateral rectus. I can say this is medial because of the superior oblique on the medial side, and the inferior oblique is here. If you see this model, superior rectus, right below that is the inferior rectus here. Then if you look for the superior oblique, then you can tell the medial lateral rectus. So that was your superior oblique, right? Then you have your inferior oblique here. Okay? Optic nerve, optic disc.
That is
that's
eye.
it. That's the eye.
Thank you.
You should have checked this before.